The situation is very unfortunate. More than 300,000 people totally uprooted from their place and homes, and the need is huge. Almost all of them came even without a change of cloth. So what we are doing is just a very, very small part of their needs. That's we all need to know. And second thing is, there are so many hurdles. It's not possible until a few months, as I said in the project, and the nutritional project when we implemented, we were able to, our coordinating organization, CHA, in Sri Lanka, that's the coordinating organization for many of the non-governmental voluntary organizations and some of the government, foreign government organization to coordinating the effort, relief work and help. And initially we were able to purchase the items in Colombo or medications or anything. We were able to transport it and deliver it to the needed hospital RDHL, Regional Director of Health Services, or MOH, or the government agent. Through them, the distribution goes through the already existing, whatever the existing network is there, the hospitals, infrastructure, healthcare workers, doctors working there, voluntary organization working there. That's the way our help is being infused. We use the same system here. We are working since 2003, so we were able to identify the right people, right organizations, and we don't have any employees for our organization. All of them are volunteers. So what we do is the need come from the ground level. It is not we identify the needs and send the supply. They ask us. The doctors there or the organizations there or healthcare workers there, they say, we have this need. Please, can you help us? Then they send us a proposal and the budget. Then we see the feasibility. And when we will send the money, it's our memorandum of understanding with the CHA, we send the money. And through that, it's being done. And at this stage, it's not possible to buy the things or transport across Madavachi to the camps. It's not permitted. And also, it's at this stage, it's not permitted to, go with a banner like IMHO doing this, and we cannot go like that. But these doctors, like our current partners, the recent ground situation, and the current partners are MOH, Medical Officer of Health from Chetikulam Hospital, and Vavuniya Hospital, MS, Medical Superintendent, and MOH there, and Manar Hospital, at the same like Trincomalee Hospital, and RDHS of the Jaffna, and also the Lions Club. They were able to, they got some access, they were able to enter these areas and deliver some supply, so we got their help. Also the Ramakrishna Mission, they were able to visit and deliver some supply, so we got their help too. So like this, whatever the organizations or individuals existing there or able to reach there, we are infusing our funds for the requested help from the grassroots. That's how it's been working. It's not enough, it's a very small portion. The need is huge. Thank you.
Thank you.
We have an online question that we'd like to address. If you can just give me 1 minute.
When you bring a question, kindly identify the name and also the city where the person is coming from.
This question comes via internet from Prem in Richmond. The question is directed to John of Amnesty International. John, what is your response to Ms. Karen Parker's accusation or comment on non-classification of Tamils as being violated in Sri Lanka by Amnesty?
Oh, okay, excuse me. I'm not a techie, not an engineer. These engineers use these things easily. To be honest, I'm not exactly sure of the reason that Amnesty didn't name Tamils, and I was interested to hear Karen say that actually, and I shall find out when I get home. But I have two answers, I think, or two suggestions. I would guess that that's the case, because I believe Karen when she says that, is that it perhaps the phrase affected persons might have been used in a strategic or political manner in order to try to get more votes for such a phrase rather than identify Tamils. It's not something I agree with, but that might have been a reason. I'm more pleased to say that in Toronto, certainly, where so many Tamils in the Canadian diaspora reside, in a couple of publications that Amnesty has published just recently, in the last month or so, we have distinctly named Tamils because we believe it's so important. And actually, just amusingly, we ran it by the Amnesty headquarters in London, and they questioned it a bit, and we just argued that it's important. It's important because of the number of Tamils here. Clearly, we name Tamils directly if Tamils are being affected. So we in Canada, dare I brag, are acting as correctly as we can. Thank you.